Hello there, I'm Janelle Marie. Welcome to Body Beautiful, the show where we talk to local professionals about the latest in cosmetic procedures and medical devices. We're also going to take your calls live on the air, so get ready to jot down the number. With us today, of course, we have plastic surgeon Dr. Joseph Mealy. We're talking mommy makeovers because, of course, springtime, right? And then again, later we're going to be taking your calls, answering your questions, anything you might have to ask the doctor about. Here's the number, you guys. Write this down. 415-561-8753. 415-561-8753. We'll also be posting the phone number to the doctor's office, so be ready to take that down as well. Before we get started, remember, any advice we give you today, we want you to consult your own physician. All right, Dr. Mealy, thank you for joining me today. Welcome back to the show. Always nice to have you on. All right, so it is springtime, and people are going to start showing a little more skin. Maybe they had a baby during the winter. They want to lose that weight. Okay, what can they do?
Well, you know, when we're not bundled up so much and we're showing a little bit more, we want to get rid of those extra bulges. So obviously diet, exercise are the #1 answers,
and
certainly very effective when used appropriately. But for those stubborn areas that don't go away, or especially for post-pregnancy when the skin is a little loose, or post-weight loss when the skin is loose, exercise really won't tighten the skin. It tightens muscles, but the skin usually needs a little more help. So that's when I get involved with things like tummy tucks or restoring volume to the breast with breast augmentation or lifts.
So you can do that all together, and of course we've heard about the Mommy Makeover, and everybody loves the Mommy Makeover. So what is that comprised of?
Well, it came about because there was a combination of surgeries that was done frequently after pregnancy, which was the tummy tuck plus breast augmentation, with or without a lift, or maybe just a lift if the size is already appropriate. So we just sort of call that colloquially a Mommy Makeover.
Oh, okay.
But it works also for people who've lost a lot of weight. So if someone's had bariatric surgery or they've diet exercises, lost 100 pounds, there's going to be extra skin. Yeah, definitely. And sometimes the breast will sag for men and for women. So I guess it could be a daddy makeover too in that case.
That's right, because men get that, and a lot of people don't think men actually do get the procedure.
They do. Not as frequently as women, mostly because we don't get pregnant. And we gain weight a little bit differently. Men, we tend to put more fat inside behind the muscle. And we can still have a big belly and not have any fat on the outside, which is what I can get to as a surgeon. Whereas with women, usually they're putting more fat on the outside, which I can remove. Okay.
So what about liposuction actually tightening the skin? A lot of people think they can just get liposuction, their skin is going to tighten. Is that true?
A lot of people can just get liposuction, and it is second only to breast augmentation in the numbers that are done each year. The difficulty with liposuction is it doesn't really tighten the skin. So if someone has good elasticity, good skin tone, and you reduce the fat that's behind it, the skin will naturally just tighten and look smooth. It will recoil. But if the skin is folding over, it's already loose, and I take fat out, really what I'm doing is removing more support for the skin. It then folds over further, and that's when we need to do something more excisional.
So that's when you need to do the tummy tuck?
The tummy tucks, or if it's the breast lift, or for arms, we do brachioplasty, which is the arm lift.
All right, so let's talk tummy tuck, because I know a lot of people talk about a mini tummy tuck. Is that even true? And what's the difference between a mini one and a big one?
Sure. I think of the mini tummy tuck as kind of a compromise between liposuction and tummy tuck. So it's for people who are kind of in the middle. There is a little bit of loose skin that's not going to respond to the liposuction. The muscle may be loose a little bit down below the belly button, and those problems we can address with a mini tummy tuck. If somebody has skin above the belly button, or the whole abdomen is loose, then we need to do the full tummy tuck in order to get the same results.
So a lot of people think the mini tummy tuck has a smaller scar. Can you talk on that?
And normally it does, because we're removing less skin.
Oh, that's good.
So the length of the scar is longer when we need to remove more skin. So when there's less skin, it's shorter, and usually with the mini there's less skin.
That's very interesting, because a lot of people just don't think mini tummy tucks are available, but you can just do that. And, and another thing.
And it's something I'm always thinking about when I'm seeing a patient, because I want to use the smallest procedure I have to get them the results they want.
And a lot of people also are scared maybe because you might cut the muscle, but that's not true.
No, the goal is not to cut the muscle. It's just, it doesn't help. But it does get sore, not because we're cutting it, but because we're tightening it. So you can think of it like putting a corset on inside.
Oh, perfect.
It's tightening that outer layer of the muscle, the tough layer, so that it holds and supports the inside.
Like tightening braces. I love that.
No metal involved, though.
All right, you guys, here's the number if you want to call in for the doctor, 415-561-8753. And if you want more information about Dr. Mealy, you can call 925-943-6353, or you can check him out on the web at either drmealy.com, sanfranciscobreast.com, or at sanfranciscoplasticsurgeryblog.com. We're going to take your phone calls next, show you some before and after pictures of tummy tucks, lots more when we come back on Body Beautiful. So stay tuned with us.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.